You're listening to the BBC's Africa Daily podcast with me, Alan Kasuja, and today we're looking at the rising Mpox cases across Africa and how businesses in DRC are stepping up to support the fight. In order to get a clearer understanding of this, I spoke to Monique Gieskes, the managing director of Plantation et Roulerie du Congo, PHC. They are the largest industrial producer of palm oil in the country and employ over 10,000 staff members. She started off by telling me how Mpox has impacted their employees and communities they work in.
Yes, first, maybe I want to draw the picture of where we are located because the operations, the palm oil production is not located in the capital city. It is located in three different provinces, areas. The first one is the province of Mongala. And the second one is at the province of Chopo, and the third one is the province of Equateur. And those are located in the northeastern part of the DRC. Knowing that the Mpox epidemic is really coming from the rural areas and it reaches the main cities. So since our operations are so remotely located, and knowing that it's really coming from the remotely located areas, it was very important for us to put in place very urgent and important measures to face the epidemic. The company has the largest healthcare facility in the country. We have 4 hospitals with 460 beds, 3 health centers, and 18 dispensaries.
So, has Mpox affected your business operation?
Absolutely. Since we have received the general alert from the national authorities, we have noticed in our hospitals the increase of the patients arriving that are showing the disease. So we have put in place, first of all, we had to put the 3 estates under quarantine. It means that the traffic from Kinshasa to the 3 estates and the traffic between the estates had to be restricted and limited to my approval. And it means that, it is affecting because the transfer of colleagues, of experts who need to travel around the plantation has been greatly limited. In the meantime, we put in place all the safety protocols and preventive health measures in the estates.
So when you say preventive health measures, does that include vaccines?
We are waiting for vaccines, but at the moment, the preventive health measures are a bit the same as the COVID-19, meaning deploying additional temperature take equipment, masks, drugs, communication material, the distanciation between people and also our employees in the plantation, our workers, harvesters, upkeep, maintenance employees. It also implies hand washing stations, disinfection of hands, gloves, masks, as I said, temperature checks, and also communications to help our community members and also employees to know how to deal with the disease once they see the first signs appearing.
You talked about waiting for the vaccines. That suggests to me that you've had a conversation about that and you're expecting them to come from somewhere.
Yes, so the national vaccines come from the government. So at the moment, the number of vaccines that they've received is very small. They've received 265,000 doses, which is not sufficient for the country. And the country needs about 10 million doses, as I hear. And honestly, we have approached the government on that. And we're on the waiting list.
It seems like there is no outbreak that will manage you. You seem ready for anything. I'm sure if there was a problem with Ebola, you'd know how to deal with it. If there was a problem with anything else, you'd know what to do. You seem to have protocols in place.
We always refer to the government, to the public health ministry, to see what is in place, what is available for them for us coming from them, because we always need to comply with what the government's putting in place to make sure that we follow the instructions and follow the prescribed measures. And once we get this information, we immediately put in place strong, because it's very serious. We take those measures extremely seriously. So first thing was to limit access to the estate, and now put in place, make available to the community members, also communication to tell them how to face the disease once the first symptoms appear.
Do you think businesses like yours have an important role to play when there is a public health crisis?
Absolutely, because we are in direct contact with the population. The way our company is organized, we can easily partner with the government and support the government initiatives by first communicating with the communities and who live in the rural areas so remotely, and knowing that the population is quite a big number on those rural areas so far away, distance from the capital city of Kinshasa. So I think we are a key partner of the government, because some of the key decision makers are located in Kinshasa, and we are out there in contact with the local communities in terms of controlling the disease and making sure that the population out there knows what to do and knows how to avoid it and protect themselves and their families.